Welcome back to the Arise interview. I'm Charles Enyekodu. Now, in the midst of the coronavirus pandemic, it's pretty clear that one of the key weapons needed to fight the virus and treat those infected here in Nigeria and elsewhere is, of course, sufficient medical staff. The death toll for the virus worldwide is now in excess of 7,500 out of more than 200,000 confirmed cases. The World Health Organization has called on all countries to strengthen their testing of people, particularly the most vulnerable. But it seems that that may not be entirely possible here in the Nigerian capital, Abuja. Why? Well, because medical doctors here have embarked on an indefinite strike. They say they've not been paid for more than 2 months. So, despite the coronavirus and the fact that Nigeria has at least 8 confirmed cases, they've stopped work. Well, for more on the Abuja doctors' strike, I'm joined now in the studio by the president of the Association of Resident Doctors in Abuja, Dr. Rowland Aigbovo. Thank you very much indeed for coming in.
Thank you very much, sir, and thanks for having me in the studio.
Thank you for being with us. What's your central grievance? Is it all about pay, or is there something more?
Well, for now, it's all about pay, because what actually, though there have been some issues before now, but what actually now triggers everything to this situation that we are now is the issue of pay. After the December 2019 end of year celebration and the New Year celebration, of course, our members were hopeful that by January they should receive their salary just to buffer the expenditure end of year and the New Year celebration. And unfortunately, the salary was not forthcoming. We didn't get our January salary. And we waited patiently because they were informed that is the occasion by the migration from the usual platform they used in the old platform they were using before to a new platform, which is the integrated personnel and payroll information system, following the directives of the federal government. And well, we waited patiently. Unfortunately, on the 21st of February, we started receiving salary payment, only for us to see a paltry sum of 5% to 10% of our salary is being paid. Imagine somebody that was a worker that was expecting to be paid like 300,000 was being paid 29,000. And we felt that no, this is not right. And we wrote to management, this is not our salary. What happened? And they said, oh, it was excuse me, occasioned by the IPPIS migration and everything. I said, okay. This is IPPIS. Today is 21st. Okay, when we met with them was Monday around 24th of February. Month is always ended. Compute the difference in our January salary, pay along with the February salary. And we gave a 14-day ultimatum because we were really, really angry, having waited for over 8 weeks of receiving salary, because our last salary that was paid was December 23rd or thereabout. So we gave ultimatum, which on the 24th of February, we had our ordinary general meeting, and the ultimatum lapsed on the 6th of March, and we gave another extension. And I will also say that after that ultimatum that was given, we have a meeting with our management staff who explained everything to us, that IPPIs, and I said, okay, even if it's IPPIs, these things can be done. Compute the shortfall, pay along with February salary. Okay, they said they need to fix make all corrections. I said, okay, fine, do the corrections with the February salary, pay the February salary, then pay the shortfall for the January along. But unfortunately, though what was done for January was not entirely replicated for February, but it still has its own irregularities. And there are some of our members, a section of our members, or a set of our members who were employed late last year. Many of them have not been paid for close to 4 or 5 months. Some of them have been working since September last year, and they were supposed to have been paid by December, and many of them were not paid, and now the migration into the IPPIS platform.
Right, so it further complicates matters.
It's further complicated.
And I mean, presumably, as you said, this has brought considerable suffering on the doctors.
Yeah.
And presumably, as you said, I mean, you'd been in touch with the government. There have been ongoing discussions about this, but those talks have not been to your satisfaction. I understand you met the Minister of Health today.
Yes. Actually, we had a meeting yesterday with the FCTA management. We discussed the issue and the way forward. And from there, we had a meeting with the House Committee on Healthcare Services yesterday. We met with the Honorable Speaker, House of Representatives, was physically present. He made appeals to us to suspend the strike action while they wait into the matter, and that this is not the time for us to go back on a strike action. Yes, I agree with them, because I don't believe in this is the best time to actually go on strike. We are aggrieved and we need to be motivated. A situation whereby a doctor cannot even afford transporting himself. When I say this, some places they said I'm exaggerating, but that is the fact. That is the fact. We all are not in the same financial pedestal. Some of my members cannot even afford to even come to work.
Right, and of course, an indefinite strike, which is what your members have embarked upon, is pretty open-ended, isn't it? I mean, not likely to end anytime soon unless you get what you want.
Yes, that is what it is. And just to also answer the previous question, there have been an appeal for us to tone down on the strike and because of the global pandemic of coronavirus. And we shot just a few minutes, about 45 minutes ago, also met with the Honorable Minister of State for FCT, still making the same appeal. And arising from the meeting yesterday, we actually have called for an emergency general meeting of my association, which will be holding by 10 a.m. tomorrow morning, for me to present to my Congress. These are the issues so far, these are the appeals, these are the steps that have been taken. And I also want to commend the FCTA management. Of course, this is a crisis situation. It's not all about castigating anyone. I will also commend them for the effort that they've made so far.
But
they have been able to open the books for us to see.
But let me ask you this. What impact is your strike, beyond the coronavirus, having on the healthcare system in Abuja, for example? I mean, at the best of times, Nigeria's healthcare system is fairly fragile.
Yeah. Well, it's really... I don't know how to quantify it now. It's really take a heavy toll on the citizens, because my members of Association of Resident Doctors cuts across all the 14 district and general hospitals.
I mean, what percentage of doctors do you make up?
What percentage? Well, we actually make up to 80% of the workforce, because we are the resident doctors.
Right. So basically, you've crippled the system. And I'm not trying to blame you. I'm simply looking at the facts.
The facts, yeah.
Right.
Yeah. Because we actually are the ones on ground to actually carry out the stuff. We are, of course, almost triple or quadruple the consultants.
Because I mean,
soldiers, so to say.
I'm looking at the fact that you gave several warnings to the government.
Yeah.
About this, and they didn't act upon it to your satisfaction. Yeah. And given the fact that they know how vital your members are to keeping the healthcare system ticking over in Abuja, I mean, it just seems like almost irresponsible on the part of the government. Not my words, just an objective assessment.
Of a truth, if there were communication, I don't think we would have gotten to this extent. Of course, the first meeting we had with management on the 4th of March, we made it known to them that these issues are coming up because there's breaking communication. When you're implementing the policy of government, yes, we are not here to tell you don't implement the policy of government, but you know there are people that are going to suffer from this policy. You inform them. It's not even going to, you have various channels of communication. All the union leaders or association leaders, you have their contact, or you can release a memo to everybody. No, we are migrating to LPPIs in January. Don't expect your January salary and all those stuff. And if things like this happen, oh, sorry, this is what's happened. We are trying to fix the problem and all those stuff. Everybody just kept mum. Right. Until we have to, why all this happening? Until
you felt ignored. I mean, you know, and you felt as if you're not valued. I mean, that would happen to anybody.
Of course, because our members were asking us questions. We don't even have answers to give to them.
Nevertheless, if I was lying sick in a hospital or my relative was lying sick, that there'd be a part of me that would be fairly angry that it has come to this, but angry not just at the government, but also at the doctors. I mean, ordinary Nigerians might say that of all the times to choose to embark on a strike, this is the worst time, with the threat of the coronavirus looming. I mean, what would you say to them?
Well, like I mentioned earlier, there's really no better time for us to go on strike. We didn't know that though the coronavirus started around January,
Right.
it's here from China and all those stuff. Yeah, but the funny thing is, we have actually tried to resolve this issue diplomatically. And it pains me really as a person that we have to be told in this part. It pains me, but then it's just something we feel we have to do.
But I mean, did you choose this particular time because you thought perhaps, given the coronavirus threat, that it gives you some form of leverage over the government?
No, really. In short, that wasn't even in our purview, talking about the issue of the coronavirus. We felt that we've issued an ultimatum of 14 days and extended by 7 days. That's 21 days. It's a whole lot of time for management to have acted. We also believe that, before now, we've given ultimatum. Keep extending, and extending. At that point, we have to vacate the ultimatum and all that, And after we vacate the ultimatum, management sees back. And those issues that were being addressed, some lay back. So we felt that at this point in time, these other issues have to boil down on infrastructure and healthcare, the work environment and all those stuff. Yes, is a work in progress, but these have to do with wages. We have families to feed. We have to bring ourselves to work. If we are not motivated, even the coronavirus we're talking about, we might not even have the right frame of mind to actually want to do what they need.
Okay, just stay with us. I'd like to talk with you some more. You're watching the Arise interview. Plenty more still ahead. Stay with us. Welcome back to the Arise interview. I'm Charles Anyegolu. We're having a discussion with the president of the Resident Association of Doctors in Abuja about their strike, which happens to coincide with the rise in coronavirus cases in Nigeria. But first, let me bring you this piece of news. The first recorded death of the coronavirus in Sub-Saharan Africa has been confirmed after a diabetic woman in her 60s died in Burkina Faso. Burkina Faso has confirmed a total of 26 cases, including its first case in Bobo-Dioulasso, the country's second largest city, and like the rest of the world, the virus is spreading there. Authorities there have banned gatherings, but there are concerns it could spread fast in the country because of conflict affecting several regions of the West African Sahel. So far, Africa has seen a relatively slow rise in the number of cases, but health experts warn that strained public health care systems could become quickly overwhelmed in countries like Burkina Faso. Well, let's return to our stories about the Abuja doctors' strike and speak some more to the president of the Association of Resident Doctors in Abuja, Dr. Rowland Aigbovo. Thank you for staying with us.
Thank you very much.
And if you look at China, many of the medical staff there have complained of being overworked, and many of them put their lives and those of their families at risk by being at the front line of the fight against the coronavirus. And the same crisis is potentially looming in Nigeria, yet you go on strike at this time.
Well, I think at this point, we are supposed to be gearing up for the worst to happen. The worst in the sense that the rise in the confirmed cases is just the beginning. That is the truth, because you know, our whole culture of clustering and not putting into consideration some ethics of living a way of life. For instance, the public transport I have, everybody is loaded in there and all those sort of things. Of course, it's going to spread easily in this country. And by this time, we're supposed to be carrying up all the places, public health concern, giving advice and adverts and doing all those sort of things. And now is the time doctors are on strike.
But I mean, do you feel that in some ways it goes against the grain of your Hippocratic oath?
It doesn't, sir. And I will tell you why. You know, like I always tell people, the original version of our Hippocratic oath actually has put us that just stated the doctors are to carry out their work or render their services if everything they needed is provided for them to work with. It's just like you're sending a workman to the field and you have not given him anything to work with. That's just the explanation. And apart from that, the revised physician's pledge have also made it clear that we should take care of ourselves first. Because when we are okay, that we're able to offer services to the other person. And like I mentioned, a hungry person is an angry person. Yes, by oath, we cannot do anything, because any mistake we make as doctors might lead to the death of the patient.
I understand that. But since you embarked on this strike, I mean, this strike began this week, didn't it?
Yeah, on Monday.
Right, and it's now Wednesday, so it's 2 days hence.
Yeah.
Have you heard from the government?
Yeah, we've had, just like I also mentioned.
I mean, I know you mentioned that you had a meeting with, you know, a number of sort of sundry people, but are you actually talking to the people who make the final decisions?
Yes, we at least we had a meeting chaired by the Honorable Minister of State. I guess because from what I learned, she had to leave the Federal Executive Council meeting to meet with us. I think the issue was raised at the Federal Executive Council, I guess, because apart from that, we also get information, or we also interact with the security forces, who, security agencies who also call to find out the situation of things and everything. I think that is the reason why they are actually meeting with us to make sure that this issue is resolved within the shortest time
Are you
possible.
confident that it will be? Because, I mean, it seems from where I'm sitting pretty straightforward. I mean, when you have someone do a job, you have to remunerate them. It's a law of contract. It's fairly straightforward. Are you getting the sense that things are now moving at a faster clip as a result of your strike?
Yes, because we actually have, other than the meeting with the Honorable Minister of State today, we also went to the office in charge, where they've showed us what they've been doing, the corrections they've been making and everything. Well, I appreciate their efforts so far, but it doesn't have to get to this for these things to actually happen, really. Because from what I've seen so far, I think they are making effort. But this effort will only be appreciated by our members when they see the results.
Yeah, it's a bit like switching on your light. You want the light to come on.
Understand.
And I mean, beyond sort of the bureaucracy of the ministries of health and labor and so on, I mean, I'm just wondering if perhaps the presidential task force on the coronavirus, which has been set up, would be a better group to reach out to, because I mean, this would be part of their remit to say, well, if we lack medical care in Abuja, we're up the creek, and guess what? We don't have a paddle.
Right.
So it's going to be a big problem. I imagine a strike by doctors of this magnitude would raise considerable concern and would put a spanner in the works of any plan they have to deal with the coronavirus.
Yeah, the Presidential Committee on Coronavirus, well, we will not want to take issues to them. Yes, it's presidential, but I also believe the Federal Capital Territory Administration have the wherewithal to actually handle this issue. If the more they drag, the more the issue escalates, perhaps then the Presidential Committee on Coronavirus might have to wait in. But I don't think they want to wait till that time. And apart from that, they've also shown us what they are doing, and maybe perhaps in the next couple of days we will see the results.
Are you scheduled to meet them again? Are there any meetings that have been sort of scheduled going forward?
Not for
Or
now.
are you just
But if
waiting
there are-
to hear
yes,
from them?
because what we're going to be doing is that when we get information, we have to go and get clarification from them. But for now, there's no scheduled meeting other than my Majestic General meeting that is holding tomorrow of my association for me to brief them and for us to take a position.
And you're assuring that the public and those who have suggested that you're using the coronavirus crisis as leverage to get what you want, that is not the case.
No, we are not using the coronavirus as a leverage. We are doctors. All we want to make, we are not making profit out of a bad situation at all. Far from that. And like I mentioned, the issue of coronavirus escape, the issues that are in contention dates back much more than even the coronavirus.
Okay.
It's just unfortunate that at the time we are not taking action,
it just happens to be that. Okay. I wish you all the very best. Dr. Rowland Aigbovo, President of the Association of Resident Doctors in Abuja. Thank you very much.
Thank you very much, sir.
That's it for this edition of the Arise interview. Do join us again tomorrow. From me and the entire team here in Abuja, bye-bye, and thank you for watching.
As many as 400,000 germs per hand. That's how many bacteria travel with us every day. So, here at the University of Maryland Food Safety Lab, 6 brave grad students and I voluntarily doused our hands in a toxic brew of thousands of E. coli bacteria. Yep, E. coli.
Good. There's something a little odd about rubbing E. coli.
To see what would take it off. First up, hand sanitizers. We tested 2 kinds you'll find at the store. One with 60% alcohol, and one so-called natural formula containing no alcohol.
That's good.
The key with hand sanitizers is to use enough of it. Your hands should take a full 15 seconds or longer to dry.
Now let that air dry, okay?
Then, we pressed our hands onto special incubation plates to grow any remaining bacteria. The results? Dramatic. Here, those graying spots are the E. coli that grew from unwashed hands. After, using hand sanitizer with 60% alcohol. But the formula without alcohol? Just look at how many germs are left behind. Alcohol-based hand sanitizers work so much better because alcohol breaks up the bacteria's proteins and kills them. But if you really want to get clean, what's your best bet of all? Guess what? It's your old friend, soap. Soap not only does as well on bacteria as the sanitizer, it gets more viruses too. Surprisingly, studies show regular and antibacterial soap are about equally effective. But how you use it is crucial.
Go.
Most of us only spend 5 seconds at the sink.
Stop.
Just look how many germs remain. Yuck.
Go.
You have to wash your hands for a full 20 seconds to really get the bugs off. And yes, that's singing happy birthday twice. So let's review it again. Hand sanitizers if you can't get to a sink. Look for one with at least 60% alcohol. But washing with soap, any kind, is better, as long as you wash for long enough.